Good afternoon and welcome to CityLine. It is truly great to be in your home. Today is Thursday, March 26th. And yes, it looks a little different. We are not in our studios. There is no comfy couch. This is my spare bedroom and we are Zooming because, of course, our Governor Inslee has issued a directive that we shelter in place and also observe social distancing. So here at CityLine, that is exactly what we are doing. My four guests will be Zooming in, and I want to say a huge thank you to my producer, Fred Yones. He has spent so much time technically trying to make this work. So hats off to Fred. Speaking of our show, we have a great hour ahead of us. Later on in the hour, we'll be talking with Richard Freed from the Cascade Regional Blood Services, and then we'll be talking with Carol Wolf. Carol is working for the Tacoma Community and Economic Development, and she is here to talk about the COVID-19 business resources for our small businesses. The Humane Society is here, Victoria is here, and she has a wonderful animal who is looking for their forever home. And then with me right now is somebody that I thoroughly enjoyed when I had her on the comfy couch 2 weeks ago. And I asked her to come back and she graciously said yes during this very busy and critical time in her career. I'm talking about Kim Steele-Peter. She is the investigative group supervisor for Tacoma-Pierce County Health Department. Hello, Ms. Kim.
Hi, how are you doing, Amanda?
I am well, my dear. My question is, how are you and how are you feeling right now?
Well, if I can be honest, I'm tired. We're all tired. We're showing up for work every day, doing our best. But just like everybody in the community, it's taking its toll on us, isn't it?
It is. The new normal has a very high learning curve, I'd like to say. So yes. I want to get right to this because I can just hear our people in our houses saying, come on, we need some more information. So first off, sure. Now that we are into the shelter at home and also social distancing when we have to go out, what are the symptoms of COVID-19 today?
Still the same. What you're looking for are fever. Do you have fever? Do you have a cough? Do you have shortness of breath? And again, most people will not have very severe symptoms. They'll be mild symptoms. They may only have one or two of the symptoms. So that's why it's really important that if you are having any cough or you think you have a cold, stay home. You don't know whether it's COVID-19 or whether it's a cold, and you don't want to risk it.
Kim, you said something that I'm so glad you paused in between those symptoms, and I want to ask you, when I have been reading about COVID-19, I have read those symptoms, and do I read them as any one of those symptoms or all of those symptoms connected together like a necklace?
I would say all of those symptoms. Certainly you will have somebody that may only have fever and cough, or they may have shortness of breath but no fever, or they may have other symptoms. We have other symptoms that are a little less common, diarrhea, headache, fatigue, but the three that I mentioned, shortness of breath, cough, and fever, are really the main three that we are noticing and are pretty prevalent among most people.
So that leads me to my next question, now that you've clarified that, and that is, who should get tested for COVID-19?
Well, we're still at the point where people who are symptomatic, should have symptoms before you get tested. You're going to want to talk to your doctor and find out if you should be tested. But certainly, if you are somebody that is one of these high risk populations, it might be if you're over 60, if you're pregnant, if you have some immune suppressive or underlying health conditions, that then definitely talk to your provider and see if that's something that you should be tested to see if it is COVID-19 or if it's the flu. You should get tested for the flu also.
All right. So give us a refresher on how does it spread? Because there is a lot of misinformation out there. So that's the reason why we want to hear it straight from the expert's mouth.
Oh, thank you. So it appears that COVID-19 is spread through droplets. Droplets are created when we cough, we sneeze, those spray out in front of us up to 6 feet. And if you're walking through that, if you come in contact, you could inhale those droplets and then it could get into your body that way. There is some evidence that it can be spread through touching a surface or objects that somebody else who's infected with COVID-19 has touched. And for that reason, we're really telling people, don't touch your eyes. See, I'm going to try. Don't touch my eyes. Don't touch my mouth. Don't touch my nose. Okay. And it's one of those things we don't realize how often we do that until it's brought to our attention. And we're all at the health department reminding each other, don't touch yourself. Okay. But that is the reason we say that, because then if there are virus on a surface, it could get into your body that way.
Okay. So if I was around somebody that had COVID-19, Kim, what should I do?
Well, if you're around somebody who has COVID-19 and it's confirmed, you're going to want to self-quarantine for 14 days from the last time that you were around them when they were infected, when they were contagious. Okay. Certainly, if you're having symptoms and you were around somebody with COVID-19, talk to your doctor about getting tested.
Okay. So is there a vaccine? And if there's not, are they working on one?
Oh, they're absolutely working on one. There currently is not a vaccine that is available. And I don't have a time frame. But boy, I know that we all feel it can't come soon enough.
Boy, is that ever true. I think that we'd like to wave a magic wand and have this over with.
Absolutely.
Kim, what is the health department doing to respond to the COVID-19 pandemic?
So our strategy has been shifting from containment to mitigation. So I'm gonna break that down. So containment is focused on the individual, on reducing the transmission from the individual. That if you have COVID-19, that you are staying home until you're no longer contagious. You're doing that isolation. That if you have been exposed, you are staying home for 14 days. That's where we're focused on with containment. So we have shifted from that into mitigation, which is more of community-based interventions, attempts to stop the spread. And those are things like closing down of public gatherings, public venues, and social distancing. And there's listening to directives from the governor about what we can do. Now, certainly the health department, we are continually trying to assess disease trends and what we need to do to stay ahead of things. And we're doing that based on guidance from the federal and the state government. So a few weeks ago, when I was on You Talk to Me, you asked me about restaurants, right?
Yes.
Said, well, if you're next to somebody with COVID-19, yeah, I guess, but otherwise, it should be fine. We put out information that said, yes, it's safe to eat at restaurants. Well, 2 weeks later, since then, the disease transmission has increased. We're seeing more cases. We're responding to the state's government's recommendation that restaurants only do takeout. And that is really that attempt to make it easier to encourage social distancing. Most of us are really good at keeping our social distance from each other during this time. We're very aware of it. But sometimes measures like the restaurant closures, in-person eating need to be enacted to help the community. Because frankly, if I could just tell your listeners, nobody wants to be that person that inadvertently spread the disease because they weren't following what has been recommended by keeping our distance from each other, by only going out if it's necessary.
Yeah, I think you've touched on a real soul spring there, because you're right. Nobody wants to be that person. And the most, I don't want to use the word scary, but the most daunting part of this is we don't know if we're that person or not. I mean, we can be asymptomatic and still, pass it on and inadvertently cause somebody to really be in critical health. So, when the health department called and said that restaurants have to close down, only takeout, I thought it was a very, very wise move. And it also protects the restaurant workers as well.
Absolutely. I agree.
What does this pandemic look like locally, Kim?
Well, I'm going to be giving you some numbers. Absolutely. Great question. So we know that transmission is widespread throughout Pierce County. As of this afternoon, we had 186 cases in Pierce County, and we had 4 deaths. We have 3,515 people who have been tested through the state lab and through UW Virology Lab. Those numbers do not include tests from private labs or from the FEMA test administered at the Dome. That Dome, over the course of 5 days, they did 996 tests. So almost 1,000 people were tested over the 5 days at that event. For Washington numbers, Washington has 3,207 cases, 147 deaths, and 43,173 people have tested negative throughout the state.
Wow.
Yeah.
It's mind-boggling to hear those big numbers. It's one thing to read it online on the News Tribune or on the health department page, but to hear it and to close your eyes and to get a picture of Washington State, that's daunting.
It is. And these numbers are obviously increasing all the time. And even we are sometimes staggered by how much they jump.
Absolutely. When you think about, Kim, the role in responding to this pandemic, what is the health department prepared to do? Because I don't know if there's much more we can do unless you have some kind of secret vaccine hiding out there. I mean, the health department is on it. They are giving us daily updates. The website is outstanding. It never goes down. Is there anything else that we are missing?
Well, I don't know that you're missing anything. What I will tell you, and it certainly is a message I think I shared last time, but that we do so much work behind the scenes. So we, again, are moving from more of that individual containment to focusing on facilities where somebody may have worked when they were contagious and didn't know it. Certainly if that's a healthcare facility or a place where vulnerable adults may work, like a retirement home or a long-term care facility, anything like that, we're looking at what we can do to assist people in the community in those areas. And we are doing a very personal touch so that we are contacting those agencies and saying, okay, you have this many cases, let's talk. What have you done? What do you need help with? Let's walk you through this process, making sure that everything's being cleaned or that cases are being kept home, or people who are exposed are being kept home for their quarantine period.
Absolutely. I have been very impressed with Governor Inslee's um, appearances, with Dr. Chin right
Yes.
there on his left hand side, stepping in, and how consistent all of the information has been. Speaking
Yes.
of that, my last question for you is, obviously information is changing daily. Where can we turn to get the most up to date local information the quickest?
Absolutely, on our website, tpchd.org. One of the pieces of information that we just rolled out is a great interactive map of Pierce County that you can click on and get information. I think it probably has cases and things like that. It's so new. I'll be honest with you, I haven't had a chance to check it out. I have seen it. I've seen it and it looks beautiful. So please visit that. Okay.
I love that. Well, you haven't had a chance to check it out because you've been working from sunrise to sunset. So I want to say thank you so much to you and your amazing team on behalf of TV Tacoma for doing all that you're doing. Kim, please keep yourself healthy, keep yourself rested. And I want you back in my spare bedroom in about 2 weeks, okay?
Of course, Amanda. Thank you for the invite.